We have a very special guest joining us from Italy right now that has been one of the worst affected countries as far as the coronavirus pandemic is concerned. Luigi Di Angelo, Operational Director for Emergency Coordination of the Civil Protection Department in Italy, is joining us live. They're at the forefront of fighting the pandemic. Luigi, thanks a lot for joining us. First up, our commiserations and our condolences as far as what Italy is witnessing right now. There are over 74,000 coronavirus cases and over 7,500 deaths. Everyone in the world is wanting to know why are the number of cases in Italy so high and why is the mortality rate nearly 10%?
Yeah, unfortunately, our country has been very heavily hit by this emergency, by this coronavirus emergency. The virus came and took us early in February, and unfortunately now we are counting all the people that have been contaminated probably in mid of January or in late January, when anybody didn't expect this situation. Unfortunately, what happened was that some contaminated people entered into the hospitals, and all the hospitals in the north of Italy, more of them have been contaminated. And a lot of doctors and nurses have been contaminated as well. And unfortunately, this brought a very high tribute in terms of death toll. But what we know, in almost 90% of the cases, these are people that have other type of pathologies, the people that are dying, and unfortunately they are old people, most of the cases.
We want to understand from you, Luigi, as you said, that the virus and the pandemic took you by surprise. And we are witnessing nearly apocalyptic scenes, especially from this area of Bergamo, where army trucks lined the streets to take away dead bodies as there was just not enough space. There are nearly 900 new deaths reported. I want to understand from you, what did not work for Italy? What are the lessons as it stands right now?
Yeah, immediately we activated the whole civil protection system, and the whole government committed in responding to this problematic. And unfortunately, what you see now is all the system in place that is responding. If I can say, lessons learned is due to the fact that especially the hospitals, especially the basic surveillance from the health sector has to be reinforced. I say to the other colleagues in all over the world, in this situation, the most important thing is to immediately detect the people that can be contaminated. There are some symptoms, of course, illness like influence. They have to be immediately detected. As a lessons learned, now we have tents for triage in all the hospitals in Italy. So if one person comes and he says that he has fever, he is immediately stopped. So in every hospital, but even in every penitentiary, we have set up some triage tents. So the most important things for my colleagues all over the world is to reinforce the detection and surveillance, to immediately identify one person that can be contaminated and isolate him. Now we have very restricted measures. All the people in Italy have to stay home unless they have an urgency. And this is something that we had to reach after days.
Was the lockdown that was imposed in Italy late, Luigi, according to you? Was the lockdown brought out late, and was it not properly enforced in the beginning? Was that one of the reasons why it spread so quickly?
The problem at the beginning was that the people didn't believe and that this was a problem. People were skeptical in understanding the risk that we were living. But everybody in the world, at people level, but even some politicians. So the most important was to raise the awareness of all the community in order to adopt the appropriate measures. And this was one of the problems at the beginning. Now everything is smoothly moving to hopefully a better situation, because people understood the rules, people stay home, and we are getting benefit. Now we are starting getting benefit, because the only way to get out is to stay home and to have appropriate behavior for this situation.
You mentioned the concern, especially for healthcare workers, that a lot of infected people came to hospitals, and that's how the spread also, spread further. That's how the virus spread further. We've seen several doctors, of course, and paramedical or nursing staff lose their lives. What are the precautions that other countries can take? You mentioned setting up tents, etc. But hospitals are overflowing. And for other countries especially, what is the best way to deal with this?
The best way to deal is, first of all, protect the doctors and nurses with the face mask, with gloves, glasses, so they have to be completely protected. And this is the most important thing to do, protect the nurses and doctors. And then open hospitals, or open, for instance, other structures, other buildings that can be hospital-like or hospital dedicated, in order to recover the different patients, in order to keep safe the main hospitals. What we are doing now is to have new buildings, even temporary buildings, where we can recover the people when they arrive immediately and they need support. And then, of course, ventilators and breath taker, because there are a lot of instruments that are needed in order to set up intensive care. Unfortunately, the intensive care beds are not as much as needed, but this is due to a policy of health system all over the years. These were not so high in terms of numbers, because they were not needed so far. And now we changed again the policy, and this is now we are running against time to set up hospital intensive care beds, spaces for intensive care patients. This is what we are running out of the time now.
I want to draw some parallels to what you're saying, Luigi, with what, of course, India is doing. You're saying that the healthcare workers have to be protected first. Of course, that's something that the Indian government has taken care of. You're very importantly mentioning that COVID-exclusive hospitals should be set up. That's exactly what's happening in India now. In fact, each state is setting up in India a COVID-exclusive hospital, so that coronavirus patients can be taken to those hospitals and special structures and don't end up contaminating other hospital visitors. You're also mentioning about the lockdown not being enforced or not being taken very seriously initially, which is why we are continuously enforcing the fact that people must stay indoors. You may appreciate, Luigi, that currently India, a population of 1.2 billion, is under a lockdown for 21 days. India has also extended international travel ban till April 14. Were these the things that Italy was slow on? Because clearly the contamination was brought to India by foreign travelers. Was Italy slow in shutting off its borders?
Yeah, exactly. I followed during these days what happened in India as well. And I think that the government adopted appropriate measures. But apart from the measures, what is doing the real difference is each citizen. Each of us can contribute to stop this war. Unfortunately, this is like a war. Anybody of us can contribute actively if we adopt measures, if we stay home. So I know India has a lot of people living high density, but it's very important that each citizen, as we are trying to do in Italy, stay home. And we have to take care of the health people, of the older people. The older people are the most fragile. So we have to do this sacrifice, especially for them, for our grandparents and for the old generation that now are suffering too much for this situation.
I want to ask you, Luigi, Angelo Borrelli, who's the head of the country's civil protection agency, had said that he suspects that the total infected numbers in Italy could be 10 times higher than what has been reported. The reported number is 70,000. So are you expecting 10 times of that, 700,000?
What we are reporting on a daily basis is the number of people that are assisted by the health sector and by the civil protection system. So it means people that go to the hospital and declare that they have a problem. And that's what we report on a daily basis. We do not exclude that some people can be contaminated and can be well-being. They stay home. They keep being very well. They don't have symptoms. For us, there is a possibility that some of people can be contaminated, but they didn't declare because they don't have symptoms. This is part of this emergency. We always bring out numbers which are very clear. The people that we assist. All the rest of people that can be probably at home can higher the numbers, but as well as they stay well, they feel well. We hope that it will continue like this. We don't have to care about them.
The other very key issue has been testing. A lot of countries have followed different models, Luigi. Some have tested nearly all of their population, or at least large percentages. Others are following a very targeted testing module, as in India. What do you think are the lessons as far as testing is concerned?
The testing model is very important in order to identify if one person is affected by coronavirus, because we have to adopt the appropriate measures in terms of health assistance. So I'm not very much affiliated to the testing models, because we don't need to know exactly what is the total population affected. We try as a civil protection system, we try to concentrate on those people who feel ill, that are in need for help. If we have other people that are affected but are in good health, then it's a matter of numbers and figures. But as a civil protection approach, we want to focus on the people that need help.
Right. I think that's roughly what India has also followed. One, of course, those who have tested positive, their contacts, and especially those who are high risk, like those who have returned from overseas in India. We are focusing on testing just them, but of course, testing is being ramped up. Very quickly, I just want to ask you a final question. You seem to have received some help from China, which is looking at the pandemic in the rear view right now, if we believe the reports. What is the help that you are receiving? What more help does Italy need?
We are receiving help from different countries. From Germany. In Germany, we are sending our intensive care patients from Regione Lombardia with with the transport which is protected transport. We are receiving support from China as well, as you mentioned. They are sending us face mask, ventilators, means and materials, but we are still in contact with them in order to ask for receiving a field hospital, because we would like to get benefit from the big experience that they gained during the Wuhan emergency. And so we want to get from those doctors, from those nurses, the experience. And we are asking for a field hospital, and we hope to receive it soon in Italy.
Luigi D'Angelo, thanks a lot for speaking to Republic TV. We wish the people of Italy all the best. We hope you recover from the crisis as soon as possible. And of course, any collaboration with India would be very welcome. Also, thanks a lot for emphasizing the need for staying indoors, for respecting the curfew and lockdown, and maintaining social distancing. Those are the key lessons that we can take from Italy. Thanks a lot, Luigi D'Angelo. He's at the forefront as part of the task force fighting the pandemic in Italy.